Hello, hello, community. I am so excited to have Dr. Jill Jennings with us tonight. You guys, she is not only a Chicago local, I can talk, she's not crazy. She is local to Chicagoland. And the other awesome and amazing thing is she is leading a holistic life and has a holistic practice and a degree in naturopathic medicine. So welcome, Jill.
Thank you. Thank you so much for having me.
I am so excited and I'm honored that you're here with our community and that you're sharing information with us. Do you want to explain a little bit more about yourself and how you got into natural medicine?
Absolutely. I always like to start off by telling a little bit about who I am and how I got to where I am, because it's a significant kind of part of my story. So I have worked in the hospitals for over 20 years, and 15 of those years as a ER nurse before becoming a doctor. And during that time, I had gotten really, really sick. And it kind of progressed over the course of about 10 years. I had seen every doctor you can imagine. I was on dozens of medications. I had every test they could think of. Nobody really knew what was wrong with me or what to do with me. And it was at that point that I was getting ready to file for disability. And I felt like I was out of options. And a couple of my dear friends said, "You need to go see our naturopathic doctor." And at the time, I'd worked in the hospital for over 10 years, and I thought, what do they know that, I haven't already tried? But I was desperate. And so I took the name and number, and we drove 10 hours to go see this doctor down in Missouri at that time. And to make a really long story short, over a period of time, he got me well. And I'm like, this is crazy. And I thought I knew a few things about medicine. It turns out I knew nothing. And so I really started to dig in and do a lot of research on what was the difference between what I was doing in the hospital and what these naturopathic doctors were doing. And what I discovered was so elementary, yet so very, very profound. And what I discovered is that what we do in the hospitals is we treat symptoms with drugs, and then we treat side effects with more drugs. And what these naturopathic doctors are doing are saying, okay, what are your symptoms? What's causing the symptoms? Even down on the cellular level, what really is the root cause of the issue? Let's address that, fix that. And the body's very, very smart. And so a lot of times the body can heal itself by just doing those things. And so it really was so profound to me. And my journey was just so profound. And it was really a spiritual journey for me too, because I had wanted to be a doctor my whole life and kind of walked away from it. But, at that time I thought, this is a kind of medicine I want to do for the rest of my life. And so at the age of 40, like a crazy woman, I went back to medical school with 4 kids. Who does that? But it was just really God's calling on my life. So went to an accredited 4-year naturopathic medical school, did a 1-year internship in the clinic there, and just really got hands-on on doing more of this natural medicine. It's just so profound. I just learned so much, and it's just such a passion for me now. And I just love every day of it.
Wow. So talk about just years and years of being in healthcare. And like you said, it was a journey. You started out in our traditional world of what we look at as healthcare, and you've moved into the holistic world because of your own. I find that so interesting, because a lot of us, that's how we got there. It was our own health or our family's health that made us go for that root cause analysis.
Yes.
Versus
absolutely.
the symptoms.
Absolutely. And, I tell my patients too, I said, it's not necessarily their fault, your doctors and your nurses. We just don't know what we don't know. We aren't taught. And, it's through, unfortunately, some of us, our own journeys, that we have to take our own health into our own hands and find a different way and just find a better way. And, I've had the privilege really to work in traditional American medicine and to now work in naturopathic medicine. And my own experience is so valuable to me. Looking back, as difficult as my illness and my journey was, I wouldn't trade it for anything, because I wouldn't be where I am today. And there's value in being able to say to my patients, I get it. I've been where you are, and let's do this together, and let's walk out this health journey. Yeah.
You have that empathy.
Yeah.
Yeah. I love that.
Yeah.
I don't love that you had to go through it, but I love that you can relate.
There is value in the journey.
Yeah.
Yeah, for sure.
Yeah. So the month of October, we as a we're a Thrive Clean Eating community. We focus on food as medicine. And
Awesome.
what we've been diving into is cancer strategies, cancer prevention techniques, holistic ideas, and like a supplemental or complementary treatment when you're going through treatment. And I know that I have heard, and you've told me that is one of your areas where you love to help people.
Yes, cancer is one of my many passions for sure, and really cancer prevention. You know, I've worked in healthcare long enough to literally have seen with my own eyes just the incidence of cancer just explode, and really seeing these patients in the ER day in and day out, just so very sick. You know, I got to the point and I'm like, what is going on? You know, what we're doing is clearly not working. You know, back in 1971, President Nixon said, we're going to wage the war on cancer, and poured, you know, that hundreds and thousands or however many dollars into cancer research. And look at us, like the current statistics are 1 in 3 women in their lifetimes are going to have cancer, and 1 in 2 men in their lifetimes are going to have cancer. That's terrifying. That's scary.
So sad. I talked to somebody today that started chemo a week ago and
yes,
looking for some complementary things to get their energy back.
Absolutely. Absolutely. And you know, what I try and teach people is, you know, cancer is not a disease. Cancer is a symptom. Cancer is a symptom of something out of balance in your body. And you know, with October being Breast Cancer Awareness Month, and, you know, November, Movember, we call it, being, you know, Men's Health and Testicular and Prostate Cancer Awareness, you know, what I try to educate people is cancer is not a disease, it's a symptom. And we can take a woman and cut off their breast and do a lumpectomy or mastectomy, but we haven't fixed anything. Their body is still primed for cancer. And until, again, you heal the underlying cause, that's why all these women come back a second time with cancer, even worse the second time, because you haven't fixed the underlying problem.
That root cause.
Yep, exactly. Yeah. Exactly.
Gotcha. So what are some strategies that you have with your patients or with people that you help in leading up to that prevention?
Yes, absolutely. So, you know, I really started to dig in and really search a lot of the literature and really tap into a lot of these alternative doctors who are doing alternative cancer care. And I just have learned so very much. There's, you know, tons of doctors around the world who are doing alternative cancer care, and just had the privilege to meet and sit with many of them and learn from them and hear what they're doing. And it's just really, it's profound foundational medicine. You know, the bulk of what I do is I teach on nutrition, because literally it's life altering and life saving, and America needs to get that message, you know. And this is what I tell people. It's, again, it sounds so simple, but it's really so incredibly profound. There is not a single cell in your entire body that is not a direct result of what you put in your mouth. It's the foundation of life. It's the foundation of every cell in your body. So how your immune system is going to function, how your skin's going to look, how your heart's going to, everything. It's the building blocks of life. So we need to really, think twice about what we put into our mouth. So I do a lot of education on nutrition and clean eating, as I know that you do as well. And, you know, there needs to be more of us teaching about this, because it's so profound. I mean, we're the sickest country in the world, yet we are the most scientifically advanced country in the world. We're the world leader in research. We're the most vaccinated country in the world, which should mean we should be the healthiest country in the world, and we are not. We are the sickest country of the world, because, you know, that's not where it starts. It starts with what we put into our mouth. So I do a lot of teaching on nutrition. We need to get away from our fast life. We need to get away from the fast food, the convenience foods. You know, we need to go back to how our grandmothers fed us when we were kids, out of the garden and everything homemade, because it's life-giving. So more whole foods, whole food nutrition. If you can plant it in a garden, if you can pull it off of a tree, that's what you should be eating. Less processed, less manufactured. The less you have to do with it, the more nutrient dense, the more power packed it is with those micronutrients, those phytonutrients, everything that we need on the cellular level for our bodies to function the way God intended our bodies to function. So that's always, always, always number one. Diet is always number one. And a lot of times when we talk and teach patients about diet, they have things that'll clear up. They'll be like, oh yeah, my headaches are gone, or my constipation is gone, or stuff that we weren't even targeting. Yes, give the body what it needs. Give the body. So nutrition is always, always, always number one. The other big thing when we're talking about cancer is we're talking about toxic overload. The body can only take so much. And especially when I'm talking about nutrition, patients are like, oh, well, I've been eating this way my whole life. And I'm like, well, exactly. Your fried bologna sandwiches and your macaroni and cheese and Spam and Oreos and Cheetos aren't doing you very, very well.
Yeah.
So educating on that, but it's the toxic load. I tell my patients, even if you're, 30, 40, you've eaten this way your whole life, it's like if I took a cup and I took a dropper and I filled it up with just drops of water, you could do that for a long time, but eventually the cup is going to overflow. Mm-hmm. So it's an overall total load of toxins that our body's exposed to from many, many things. We live in a very, very toxic world. So I teach about some of those toxins to be aware of, things like what you put all over your skin. Your skin is a huge organ, so you're absorbing a lot of that. So using clean products that you're going to be putting on your skin, your makeup, your healthcare products, your soaps and shampoos, and even your cleaning products that you're using in your home, being very aware of the things that are in those. There is somebody had shared with me, I love this, couple of apps. Of course, there's apps for that. So one is called, one is called Fujicate, and that you can scan a label for the food. It gives you a grade A, B, C, D, and it'll tell you why, what is in it that's not good. And the other one is Think Dirty, and that's for your cleaning products and your body care products to tell you, is it a good for you? And it'll kind of grade them.
What do you think about laundry detergent? You're talking about skincare.
Laundry detergent as well. Again, I have several recipes for like the homemade laundry detergent. But again, a lot of those have toxins. Again, you're washing your clothes and then you're wearing those clothes all day long and your body's absorbing those. So yes, absolutely. All of those things.
Okay. So anything that touches our skin or our body.
Absolutely.
Gotcha.
Absolutely. So again, cleaning products, body care, laundry, all of those things that we need to start thinking about what our body and our skin is exposed to. Another big thing is, everybody knows about the plastics, don't heat up in the plastics. That's a common knowledge thing today, in microwaves and things like that. Root canals. There's been a big, big link with cancer on root canals. I recommend everyone I refer everybody to a biological dentist here in the Chicago area that knows all of the research with the link of root canals and cancer. So find yourself a really good biological dentist that knows this research and the link between root canals and cancer.
And if they need that information, they can reach out to you.
Yes, absolutely.
Okay, fabulous.
Absolutely. Actually, he has patients that comes to him from all over the U.S. Wow. I was actually in his office just for a day. And there was a woman sitting there from Philadelphia to amalgam removal. We know now a lot about mercury and amalgams and silver filling. So it's exposure to that constant off-gassing. And so find a biological dentist who knows how to appropriately and correctly remove them. Okay. And the dentist that I refer to does, but I'm sure that there are many across the country. So, do your homework in that regard and find a really good biological dentist for that. Another really big, big thing that is kind of new and upcoming is our exposures to EMFs, magnetic fields. And there's research that they've done on, cell phone use and what it does to our brain chemistry and the link between brain cancers and using the cell phone. So we're a little bit more aware of that. But what we're not quite so aware of is that the overall exposure. Everything's Wi-Fi now. Our TVs are Wi-Fi and everything is wireless, and we got our Bluetooth, and we've got, so it's just this massive onslaught. And now we're moving to 5G. Nobody knows what this is doing to us. And so they're finding that it's changing our DNA. It's changing our mitochondrial functions.
Wow.
It's scary. So
it's turning us into mutants.
Who knows? It remains to be seen. I don't know.
My gosh,
right in front of you, but just being really aware. So what I instruct patients, and I see a lot of patients with sleep issues. And the very first question I ask them, do you sleep with your cell phone at your bedside? Mm-hmm. Yeah, I do. Okay, don't do that. Mm-hmm. So I always recommend keeping your cell phones and your computers and your laptops and your iPads out of the bedroom when you're sleeping. The better bet is to turn all the Wi-Fi off in your whole house when you're sleeping.
I have heard that.
Yeah. Yes, because they found that it disrupts your brain waves when you're sleeping. And I have patients say, oh my gosh, I sleep so much better. Yeah, like we don't know what these, it affects your brain waves when you're sleeping. And so again, they're seeing some links with cancer with this too. And, there have been way back when they saw a lot of childhood cancers with these homes were right underneath these giant power lines. And, again, we're just exposed to so many things that we don't even know what it's doing to us. So just being aware and reducing your exposure to those sort of things is key.
Awesome. Yeah, that makes complete sense.
Yeah.
Yeah. Those are some great strategies.
Yeah. And, another really, really big thing, Tiffany, when we're talking about cancer and naturopathic medicine, as a naturopathic doctor, my job is to treat the whole patient. When I was in the hospital working in the ER, we'd have a patient come in with, say, chest pain. And of course, we're going to rule out those big bad things when it comes to cardiac. But if I don't address the whole patient, I'm going to miss it. If my patient is there with chest pain because their anxiety is so stinking high they can't even function, and I don't address it, I'm missing the mark. Mm-hmm. So when I help any patient, I'm going to address the whole patient. And particularly when we're talking about cancer, I'm going to address the mental emotional, because it's a huge, huge, huge piece. I mean, cancer is so very overwhelming as far as a diagnosis that if we don't address the mental emotional, we're missing a huge, huge piece of the puzzle. There's been research that's done that says anxiety and fear makes a patient more susceptible to recurrence of cancer even after they're in remission. There's also a lot of research on patients who are spiritually connected and have a great spiritual backing and relationship with God do better. They've also shown, there's a doctor, an alternative cancer doctor, his name is Dr. Buttar. I had the great privilege of meeting him and sitting and talking with him for a while. He's down in North Carolina, and he told me the story, which was so profound. And I tell everyone, particularly my cancer patients, this story, because it really makes the significant point of the mental emotional component of that. So he had 2 cases on 2 separate occasions of patients with very advanced cancers, and they had come to him for treatment. He started treating both of them, and on 2 separate occasions the patients died, unfortunately, shortly after he started treating them. And he approached the family and said, I'd like to do an autopsy. And they said, well, that's ridiculous. We know why they died. Why would we do that? Yeah. And he pressed them, and they agreed and allowed. And on both occasions, there was not a single cancer cell in either one of these patients' bodies.
Wow.
They had cancer at some point, and somewhere along the way, they had been cured, but they were convinced that they were dying of cancer. And they died, but it wasn't of the cancer. So the power of the mind is incredible, incredible, incredible. And I just, sad outcomes of the stories, but it really makes the point that it starts in the mind. And how we perceive and approach things is so profound to our overall
so having that happiness outlook or that positive self, no matter what your diagnosis is, moving
that's forward. Correct. Okay. That's correct. And I always I love to laugh. And so I always encourage my patients, get around people who bring you joy and lift you up and can make you laugh, because there's tons and tons of research on laughter and what it does even at the cellular level in our bodies. So, we can sit and we can dwell on what's going on, but it's going to be destructive, just changing your perspective and making goals for you and gratitude journals. And I encourage my patients to do something called a joy list. What brings you joy? What do you love to do? And do a couple of those things every single day, and just, live out your dreams to the best you can on a day-to-day basis.
I love it. I love it so much. If people have questions, I know they'll comment below the video when we post it, but if they don't feel like sharing it publicly, how do they get a hold of you, Dr. Jennings?
Absolutely. You can find me on Facebook, Dr. Jill Jennings, and you can message me there. You can also email me at askdrjennings@gmail.com, or you're always welcome to call the office. The number is 815-900-2575.
Thank you so much.
Yeah, thank you so much for having me, Tiffany.
Excited that we have this information to share and that we're sharing you with our community as well. People are actively seeking strategies. They're seeking ways to get prevention. So I'm very, very grateful.
Yes, and I'm so thankful for people like you teaching people about nutrition and healthy eating and all of that great gluten-free stuff. And keep doing what you're doing.
That is, yes. Thank you so much. All right. Thank you again for joining us.
Thank you.